Well, hello everyone, and it's great to see you all joining the screen, filling up our lovely screen as I come to you from the traditional lands of the Whadjuk people of the Noongar Nation here in Perth, and we acknowledge this incredible tradition that's been bequeathed to us and the ongoing relationship that Aboriginal people have with their land. And we're about to discuss a topic which couldn't be of more importance not only to the nation, but also to, in particular, Aboriginal people. Can I begin by, as well as welcoming you, to just give you some basics about this process. First, it's brought to you by Thrive by 5 and Tali Health, and it's a discussion about early childhood development. But we were hoping to record the session and upload it online later. So just obviously, even though you're sitting in your own lounge rooms or wherever you happen to be, just remember that it is a public forum, and so conduct yourself accordingly. We encourage you to keep the video on if you can, because we found it really creates a sense of being together with these Zoom facilities. So if you're on a computer laptop, you can set the screen to gallery view by clicking the button on the top right hand side. You can see all the faces, and it creates a sense of us all being together here. So everyone is muted, and an admin person will unmute you if you're being called on during the Q&A. And we encourage people to use their full names if you can. If you're representing an organisation, just drop that in as well. And if you're having technical issues, just send a private message to our tech support person in the chat, and they'll help you through that. So welcome, and I want to just speak to you a little about the campaign, which is behind me on the banner, Thrive by 5 campaign, which is, as the name suggests, all about making sure that children in those first 5 years flourish and are able to grow into healthy, happy adults with the full range of their developmental capacities switched on in those early years. And we're campaigning this on a public campaign to try and bring about essentially systems change, to close the gap between what we understand and know about early childhood development and also the policy responses that exist at the moment. So we know that the size of a child's brain reaches 90% of an adult's by the age of 5. We also know that those first 5 years are absolutely crucial for shaping the developmental learning, behavioural, health trajectories for a child for the rest of their life. So that's why we're heading this campaign. The arrowhead for the campaign is to have a universally accessible, high quality early learning system for every child in this country. So think of a counterpart to our education system, but in the first 5 years. This is complex because it involves many service systems. At the very least, child protection, infant and maternal health, the community and family services, preschool and childcare, and all of these sort of different levels of government, different agencies, and there's no connection between them. There are significant gaps, significant accessibility issues, and significant quality issues. And when you consider the importance of those first 5 years, that's an utterly unacceptable circumstance. And so it must change, and that's what we're campaigning for. Research has told us that if we can bridge this gap between what we know and what we do, we can have profound benefits for not only every individual, but in aggregate for our nation. Not just socially, but also economically. This is a massive prosperity play. So the complexity of this, of course, is that it's not just about governments and service systems. It's about parents in what's regarded as sometimes a domestic sphere or something which is beyond the reach of government. So somehow bring the bridge between the science and the parents is really the practitioners, the people that many of you represented around this table, who actually play that critical role in translating this information. So what we really want to understand, I think, is that proper reform means that parents, particularly mothers, are able to negotiate this critical relationship between parenting responsibilities, and also the world of work, but also the quality of services, and also the critical relationship of fathers and their connection with their families. So these are very powerful and complex issues that involve lots of social mores, which have built up over centuries. And so being able to resolve them is one of the complex public policy issues that we face. So it's my great pleasure to introduce to you a range of these key experts and decision makers to hear what they have to say about this important topic. I'd first like to introduce Dr. Simone Ginditis, who is going to essentially conduct the rest of today's session. Dr. Simone is a psychologist and a clinical lead at Tali Health, a software company which is producing evidence-based digital tools to address neurological conditions in early childhood. Simone's PhD research evaluated the clinical use of smartphone apps in adolescent therapy from the perspective of both clinicians and clients. And Simone currently sits on the Educational and Developmental Psychologist editorial board within the Social Media Communications portfolio, and is an appointed member of the APS College of Educational Developmental Psychologists National Committee. So thank you very much, Simone, for conducting today's session. And it's a great thrill to have you and the team of people that you've assembled to speak to us today. Thank you.
Thank you, Jay, for that introduction, and welcome everyone. Research consistently affirms that access to quality early learning experiences results in a number of positive benefits in children's social, emotional, and academic skills, as Jay alluded to. This should come as no surprise, given what we know about brain development. As Jay mentioned, a child at birth has approximately 1/4 of the brain size of an adult, but by the age of 3, a child's brain has the most neurons and synapses than at any other stage of life. And by the time a child reaches 5, their brain has grown to around 90% of adult brain size. As many of us would have experienced, these inquisitive little creatures are walking, talking sponges. The first 7 years of life lay the foundation for later health and development, with children's brains constantly developing the circuitry needed to best understand and navigate the world. This process is highly influenced by a child's environment, with access to nutrition, healthcare, play-based and structured learning opportunities integral for all children starting their first year of life. According to the latest AEDC data, in 2018, between 6 to 15% of our Australian children starting school were identified as demonstrating below expected developmental competency in key areas of development, such as their physical well-being, communication, social skills, emotion regulation, and attention. That's upwards of 40,000 Australian children each and every year. These numbers flag the significant need for increased access to high quality early learning and intervention programs across both of our health and education systems. Without access to high quality services and programs, some of the indicators for neurodevelopmental disorders such as dyslexia, ADHD, or autism spectrum disorder may be missed, meaning opportunities for life-altering early intervention is also delayed. Our health and education systems are therefore central in providing access to critical positive early learning experiences for our Australian children. For children to receive timely support, a collaborative and value-based relationship between our health and education systems is needed. And that's what brings us to today's session. Today's panel consists of some phenomenal women who are playing instrumental roles at the intersection of these two systems, involved in ongoing national research programs, design and implementation of early childhood health and learning initiatives. It gives me great pleasure to introduce 2003 Australian of the Year, Professor Fiona Stanley, Dr. Rosemary Cahill, Chief Investigator of the Early Years Initiative at Telethon Kids, and CEO of Spell Victoria, Claire Stonia-Kippen. Thank you all for agreeing to join us and for giving your time up today. To begin, each panel member will have 5 minutes to address the following question. How might we reimagine the relationship between the Australian health and education systems to promote better outcomes for children with attention and learning difficulties? We will then open it up to questions, but there is a chat function, so please use it to ask questions or to make comments throughout today's event. First up, Professor Fiona Stanley.
Thank you very much, Simone, and I'd like to acknowledge that I'm actually in the land of the Koori people here in Melbourne, trying to get back to Perth on Friday. I'm quite old, and I think this issue about reimagining the relationship is, I go back 25 years on this, and we were reimagining this whole of government relationship then. And I think it's really important that there are many syndromes. There's just not one diagnosis for either attentional problems or learning disabilities and difficulties. There are many syndromes, and there's no natural history. There's no one natural history. There's different patterns of progression. And what I'm interested in, has always been fascinated by and wanted to do something about, was to understand the pathways into these problems. And many begin very early. In fact, not only just in utero with things like fetal alcohol spectrum disorders, but even before in the pathways that result in women drinking, for example. I'm using the FASD as an example. So my bias is very much in prevention of these disorders, and I think others may have much more expertise about how we manage them and get health and education in for that. But primary prevention is about avoiding that pathway. But secondary prevention, which is the early diagnosis and management you've talked about, Simone, is absolutely crucial as well, because it avoids even more poor outcomes and trauma later on. So there are various opportunities for interventions which are still, I think, classified as either primary or secondary prevention. Now, many of the pathways that we know affecting brain development have strong social gradients. That means that they've got higher rates in those with poor socioeconomic circumstances or difficulties, for example, Aboriginal families who've had the impact of intergenerational trauma and the stolen generation. But it's very important to know that it's across the board, it's across the whole social spectrum that we see children who struggle at school and parents anxious about the development of their kids. There may in fact be some underdiagnosis in lower socioeconomic groups, because in fact they're not seeking or able to access, like some Aboriginal families I know well, the diagnosis and treatment that they know. And parents vary a lot in their ability and capacities to manage such children. And of course, that can lead to a very difficult cycle of the child and the parents and those sorts of things. So I think we can make a very strong case for a whole of government approach, not just health and education, but other welfare services as well. Not forgetting youth, who are going to be parents in a minute. I think this is, you've got to look at this as a whole of life capacity. But services that should all participate include disability, families and communities, and even the justice system, who stands to gain a huge amount if we get this right, and will suffer with a lot of payments. We've worked out, Thrive by 5 has worked out the huge cost to our community of not intervening early to prevent all of these things, not just in health and mental health and educational problems, but in the justice system. So we have a fabulous opportunity here. So in summary, I think we've got to have a whole of government approach, not just health and education services. Why not a minister for early childhood, as Jay Weatherall was in South Australia when I first met him? Most parents want to be good parents. We've got to enable them and not disable them to be parents. All departments will benefit. And whilst I think we need to have a focus on primary prevention, and we've got to realise that it's not just parents and families, it's the communities, grandparents like me, and we have to look at the social determinants. And I know this sounds, oh gosh, it's a big thing to look at social inequalities, and a big thing, but that's where in fact you can do these things at a community level to overcome some of those social determinants. And I just want to finish by saying that we need to empower the Aboriginal voice. It's been shown brilliantly in COVID that it's succeeded better than any other community in the world. And we've got fabulous models of Aboriginal early childhood services, which have been cut by the federal government, which is a disaster. But the example is June Oscar in the Fitzroy Valley, which had the best strategy for fetal alcohol spectrum disorders that I have ever seen internationally. So thank you very much.
Thank you for your comments, Professor Stanley. Next, I'd like to ask Dr. Cahill for her views. We'll just quickly take you off mute, Rosemary.
Sorry about that. Thanks so much. And look, it's such a privilege to be part of this exalted panel today. I'm pleased to say I'm on Wadjuk Noongar country in Perth today, and what a privilege it is. I really, in terms of the question, I really wonder whether we're asking the right question. You know, the question that's been posed about whether we need to reimagine the relationship between Australian health and education systems. And I, as a researcher, I know how important it is to really nail the question before you sort of forge ahead with engaging in research. And so the focus in the question is about the relationship between health and education, which are important, but should not be where the challenge about reimagining starts. I think that should start with reimagining the relationship that services more broadly have with parents and families. This really resonates with, I think, Jay's introductory comments, with Bronfenbrenner's ecological systems theory, and of course with, I think, much of what Fiona just said. The way that health and education systems work together in the service of families and children should then flow, along with those other sorts of services that we talked about. And it's likely to look different in different places. You know, here am I sitting in Perth, where the context of delivery and experience of parenting is quite different from where I grew up in Wheatbelt, Western Australia, in a small country town on a farm, and again is quite different from the contexts that Fiona just referred to, you know, up in Halls Creek, and other places where you know, June Oscar and her work is undertaken. And I'm really reflecting upon some research that was undertaken by Steve Zubrick, and a quote that resonates with me, and it's that pumping more services into the base of the cliff leads to more services, not a smaller base. So if we want to actually achieve that smaller base, then service responses just lead to fragmentation, and we really do need to focus on the families and those connectedness. I think another aspect of the question, which I'll just raise as an aside, is that I think we really need to think hard about what better outcomes for children means. I'm quite certain that around the table here, we probably don't have a shared view about that. You know, there's not time here to fully explore that particular angle. My view is we need to guard against narrowing this scope too early. And I think the AEDC does a terrific job of actually keeping that fairly broad, particularly for children at age 5. And as someone who has had a career working in education, I worry that we sort of tend to narrow what are considered to be important outcomes for children a little too early when they get into the school sector. So I think that's, you know, a sobering thought, although I am encouraged that I think the educational goals through the Mwati declaration that occurred, arisen out of Alice Springs recently, was encouraging in that regard. But again, drawing on Steve's work, you know, a list of sort of the outcomes that we should be paying attention to are things like, you know, the emotional regulation, exploratory behaviour, communication, self-direction, you know, intellectual flexibility, self-efficacy, etc. So these capacities provide a really strong platform for successful learning, and need to be incorporated into the things that we explicitly plan for in the service delivery and our partnerships with families. I think, you know, as per some important work that Professor Colette Taylor undertook through a study called E for Kids, children who are anxious or don't understand their role in the work that they're doing tend not to be well placed to engage in learning. So we really do need to pay attention to a broad range of capacities in children. So back to serving families, I think we need to focus on serving families rather than delivering services. In terms of health services, education services, our preoccupation should be about serving families. And this therefore places the onus on us to be relevant and helpful and respectful of what families want and what they need, and not to sort of jump too quickly to our own conclusions about what we think they need. I think, you know, being open to the perspectives of families is vital in that regard. We know that if families feel uncomfortable in terms of their engagement with services, they're not likely to come back. And so, you know, this is what we have. We have the situation where that we've got these amazing services delivered across the country, and the families that we most want to engage with are the families least likely to turn up. And therefore, we need to ask some hard questions of ourselves about the extent to which we are really reflecting the perspectives and needs of the families that we seek to serve. Because, as I said, if they feel uncomfortable, they won't come back, despite the good intentions of much of the service provision and support that we're able to provide. So in addition to having really good technical skills in our fields, because we need to be able to answer the questions that families bring, and also the answers that we provide need to make sense to them. Because we need to remember that in terms of responding to questions that families pose, they'll be setting our answers against what Dr. Google says, or what their mother-in-law says, or what their best friend said. So it actually needs to be, you know, the support and advice that we provide needs to be really reflective of the perspectives and the language and the needs of families. And this is where I think health and education need to be on the same page. They need to be really careful not to undermine each other's efforts to support families and to see things from their perspective. So the bottom line from my perspective is, if we don't deliver or make families feel comfortable, they won't come back. They won't even turn up in the first place. You know, Fiona referred to her long experience in this field, and I can refer to an experience that a friend just told me about recently, where a you know, her mother felt terribly inadequate in a circumstance and simply didn't come back to that particular service. And from a research perspective, you know, I've heard Dr. Sharon Goldfield foreground the need, the fact that the work that we do in education, in health, and in other services that cater for early childhood wellbeing is that the work is fundamentally relational. We need to really focus on those relations. This, of course, has been central to a number of policy responses that have been implemented in Western Australia. One is about strengthening links between parent-run playgroups and schools. Another one is child and parent centres that have been implemented, and these are places where they're kind of like one-stop shops for families. They don't cater for childcare, but the Rolls-Royce version is where a childcare service is right next door. And Jay has, I've attended with Jay, you know, several of those services where they operate tremendously well, and they do combine free services which are supportive and locally constructed that reflect the priorities and needs of families, and also something that's called KindyLink. It's a supported playgroup program focused on Aboriginal families, and it's absolutely focused, works at being a welcoming place where families can build a sense of belonging and confidence in their relationships with schools, and of course in relationships with other families and with teachers within the setting. So those kinds of relationships are a really strong feature of what I've been talking about today. And I just finished with a comment that I heard Chris Sara say this morning during an ANZOG event that I logged into. And he was imploring us to deal with children as though they are our own, deliberately adopting the perspectives of families. So this will really fast track our efforts to be personal and relational in our work, whether it's within the health, the education, or some other sector. And constantly ask ourselves, what would I want done if this was my child? Thank you.
A great question to end on. Thanks, Dr. Cahill. I'd like to invite CEO of Spelled Victoria, Claire, to address the question. Claire, I think we've got you on mute as well.
Can you hear me?
We've got you now. Welcome.
But I haven't been able to share the screen. There we go. Is that better?
Perfect.
Thank you. Thank you to Tali Health and to Thrive by Thrive for the opportunity to participate today. I too acknowledge the traditional owners of the land from where I am, which is the Wurundjeri people of the Kulin Nation, and I pay my respects. I'm here today to talk to you on behalf of Spelled Victoria, which is the peak body for specific learning difficulties in Victoria. But we are also a member of AusSpelled, which is now 50 years young, and it's the national federated body whose membership is made up of the independent spelled entities right across the nation in all states except Tasmania and the Northern Territory. So Spelled Victoria's mission is to serve all Victorians wherever they may be with specific learning disorders like dyslexia, dysgraphia and dyscalculia. And our vision is that Victoria will be a place where SLDs like dyslexia are widely understood and are no longer a barrier to individuals achieving their learning potential. And to help us achieve that vision, we work with anybody and everybody that can help us move towards that place. Now, this slide shows you some of the services we currently provide, but we do some other things. We're currently collaborating on some research, and we're working towards reopening our tutoring service and an online shop. And other AusSpelled members across the country all offer similar and slightly differentiated services. So to address today's, don't get put off by this very dense slide, you'll get very sort of clear indication here. So to address today's topic, that decision makers, Thrive by 5 has identified that decision makers are still regarding our early education as a bit of a child-minding service. We argue that poor language and literacy skills during early childhood will impact a child's ability to thrive during their schooling and become a healthy adult who contributes to society. Now, without the foundations in oral language shown in Pamela Snow's Language House, you know, without these foundations, the house that's built above the foundations in the primary years is not going to be strong. 1 in 5 children start school with a developmental delay, and most of these children never catch up. The consequences of illiteracy touches every corner of a personal life. It has long impacts on a person's health and well-being. We know from decades of research and pre-literacy and pre-numeracy skills and the self-regulatory skills that are needed to be ready to pay attention and learn when they get to school. At the moment, too many children are entering school without these skills. In other words, the 2 foundation stones have not been adequately addressed. And if we want better outcomes, then this has to change. So what are the skills? Firstly, receptive and expressive language. Children need to be able to listen and understand well. Then they need to be able to develop speaking skills for conversation and learn how to respond appropriately. Next, phonological awareness, which is an awareness of the structure of spoken language and the way it sounds. This includes skills such as rhyming, alliteration, and identifying the syllables in words. Then a sub-skill of this, and a really critical skill, is phonemic awareness, the ability to auditorily discern and manipulate individual sounds within words. This means a child can identify sounds k, a, to make cat, and can also swap sounds to build new words, hat, etc. So if we want better outcomes for children in early education, then make sure all those lovely literacy corners in early learning centres focus on sound-based stimuli over and above the visual, whether it's a teacher, preferable, or recorded sounds, rhymes, song, and music. Last but certainly not least, learning to count and identify numbers and compare quantities and manipulate quantities are key early numeracy skills. These are powerful predictors of school-age mathematical learning and performance. We know what skills are needed for children to be school ready. So we have an opportunity to identify the children most at risk of attention and learning delays early and minimise the long-term impact of learning difficulties. So in order to achieve better outcomes for children, we are imagining a world where there will be 1, more communication between those who do the evidence-based research and those who put it into practice. 2, all early learning centres will have multidisciplinary teams with health and educational professionals, including NDIS and that joined up approach mentioned earlier, collaborating on the needs of these diverse learners, so there is a shared understanding that language and learning problems early on impact a child's long-term mental health. The teams will bring together the expertise and skills of different professionals to assess, plan and manage care jointly. And by offering a wide range of services in-house, preschool children can receive the most comprehensive care possible. For example, a speech language pathologist would work with the children on speech and language development, which also affects communication and social skills. And an occupational therapist would work with the children to develop skills they need to perform daily activities, motor skills or proprioception. These specialists will also be able to guide parents, and I think that piece is a very important linchpin there in how best to support their child's development. Then if a child is experiencing delays in multiple areas of their development, they'll receive multiple services in one program. A multidisciplinary team can also collaborate on intervention plans. And this will be especially beneficial for those who are failing to thrive and who will require additional support. And the last thing I want to mention that we need to change for better outcomes is mandated training for all early childhood staff in language and literacy development and a basic understanding of the indicators of attention deficit and specific learning disorders. This gap in training really needs to be closed. Now, I'm sure I've exceeded my 5 minutes, so I'll stop for now. Thank you.
Thank you, Claire, and to all of our speakers for your comments. We've got a range of questions that we've had come in. I will get started with this one. It's been referenced throughout that we've had to look more broadly than just health and education and systemic change. With that in mind, who are the key agents of change that we aren't yet harnessing or connecting with? I'll open this question up to all panelists if anyone would like to jump in and respond.
I'm very happy to give the first go, I guess. The people who are not yet being involved, I think, are at pretty much all levels. And I think, you know, really, I can't really believe that in now 2021, we're still having to make the case to government for the importance of early childhood when it's something that's been known both internationally and locally. So I do think whilst we've tapped into them before, I think we have to keep tapping into them. I think this is not got to be shoved aside. And I think I know that COVID has obsessed us, and there are other issues like climate change and so on. But the way to a beneficial society, the way to a better and caring society is a very well supported, freely available, accessible childcare that's more than care, that is about creating the brain development that Jay Weatherall mentioned earlier. And I think that so that's at the political level, but at the sort of bureaucratic level, I think there is incredible wasteful silos that occur across this. And the ideas that each of the speakers have mentioned is, you know, we need to try and how can we try and put families in the middle and the services around them, the kinds of things that Claire and Rosemary have been talking about. And that's sort of, you know, the avoiding those wasteful silos, but just really supporting parents with the kind of services that they actually need. And then the other point, I guess, is the people that we haven't really properly supported, and that's recently, have been First Nations. We've actually defunded some of the most effective Aboriginal controlled early childhood services in the world. And that's going to be devastating. So I think it's about re-engaging. You talked about reimagining, but it's sort of re-engaging with the people that we need. Perhaps the people we haven't engaged with enough are the media, and we perhaps need some media champions to start really writing and doing programs, etc., on the importance of this for our nation. This isn't just about, you know, that we love children and we want children to be happy and healthy and well. That's true, we do. But this has got it's got huge economic ramifications. And so, you know, and there are lots of international economists who are supporting early childhood as the most important investment that a nation can make. And we have to get that up on the Australian stage. Sorry to go on a bit too long.
No, not at all. Dr. Cahill, Claire, anything to add in terms of our key agents of change, I guess, that we're not yet harnessing or connecting with?
Yeah, I would add that, and I guess it's a continuation of my theme about relational. I think relationships are become most potent when they're local, you know, when they're immediate, and so I think really foregrounding early childhood well-being as something that every sort of civic leader within every community actively champions, and you know, this probably resonates with Fiona's point about, you know, engaging the media. It needs to be a broad-based wave of cultural, you know, sort of community consciousness about the importance of everyone playing their part in supporting healthy well-being, you know, child well-being. So engaging, you know, community leaders and those responsible for making decisions about housing, for those responsible for making decisions about safety in the community, those responsible for making decisions about how resources are distributed within a community, you know, all of those kinds of infrastructure at a community level impact on families, which clearly impact on children. So think having that holistic systemic systems view rather than attributing responsibility almost entirely to health and education sectors is important.
The only thing I would add, because I think they were both beautifully expressed, is that joined up government of local, state, Commonwealth is really important, as much as that breadth of the professional expertise that's brought to consider the whole area and the way it intersects with families. It's just really important, and I think we've got many models to look at overseas that show us world's best practice and not. So we should learn from them and make the most of it. And there's such powerful reasons to get it right at the start, because the long tail implications of not getting it right at the start are just so significant. We just don't want to be there. Let's fix it.
They're devastating. Can I just add one more thing? And it's Rosemary sort of triggered this with me about, you know, perhaps we should think about this, Jay. We should be perhaps giving awards to local councils for how well they are creating environments for the healthy development of children and the support of parents in a world that's bloody tough out there, bloody tough. All of the indicators we have for many of the both antecedents as well as the outcomes for children, like mental health problems in parents, substance abuse in parents and so on, are rising. And so, you know, it is a challenging world, but maybe we could, because, you know, local solutions to these, as Rosemary's highlighted and Claire is nodding, may be the way that we get this. And I think local councils used to do so much more for children. They used to run vaccinations, they used to run childcare, they used to run maternal and child health nurses and so on. And that's been taken from them. And yet they were very much more able to look at their local communities and provide that in a more intimate way, because they knew about what the people in their communities needed, and it would bring back trust. I think a lot of Aboriginal families do not trust the departments that are serving them because they're frightened of the previous history. So there's a whole lot of stuff about local councils which maybe could be really good.
Yeah, it's a good point, Fiona. I went for a walk last night around Fremantle with my mask on and walked past an old disused mothers and babies thing. They used to be on every corner.
That's right.
And they're a visible part of every community. And, you know, replicating some version of that at every neighbourhood, I think, possibly through schools. I mean, I think it's a great idea.
There's a wonderful quote outside the old Subiaco Maternal and Child Health Centre, which says, in supporting the mother and child is the most important investment for the state. Now, that was put up probably in about 1920, but we mustn't forget that.
A great reminder, Professor Stanley. Dr. Cahill, you mentioned Dr. Google earlier, and it's a well-known term, and I think something that we've all either consulted or heard about over the years. I'd love to know what the panel members' views are on the role that technology plays in key early years, whether it's health, education reform, or the wider system.
Well, I'm happy to kick off, because certainly working at Telethon Kids Institute and in partnership actually with Thrive by 5, Telethon Kids Institute has and the Minderoo Foundation more broadly has developed some really tremendous resources to support families through our Bright Tomorrows parenting app, which provides really good evidence-based advice and support to families, which they can tap into and access and modify according to their own circumstances. Really good evidence-based information that kind of grows with the child. So as your child sort of gets older, so that's a really valuable resource, and it is mediated by technology. Of course, there's always a downside of technology. We know that when it's children that are actually engaging with the technology, then it can be detrimental. Like too much time spent interacting with a screen rather than interacting with a real person, notably a loving, caring caregiver or parent, could undermine things as well. So it's really important that really productive screen time is focused, and that parents get really good information through those sources.
So I could add to all of those comments by suggesting, there are some really fantastic online collaborative tools to bring parents, teachers, medical professionals together, whether it's something like what we're doing right now, but it offers that opportunity. Technology also would have make the teaching of phonological awareness and phonemic awareness more effective, whether it's face-to-face or remote, because I think we all recognise now that there are face-to-face teaching opportunities as well as remote that we need to have answers to. Online screeners, I think, is another role technology can play. I mean, I know Tali has a Tali Detect screener, and Ausspeld expects to launch in mid-2021 a range of screeners, including for 3 different age groups, that will highlight literacy, numeracy, and foundational skills for writing, cognitive and language skills for reading. And those online screeners play such a potentially really important role in terms of, holding up the red flags of where there might be issues that need to be followed up more appropriately. The other thing that Ausspeld has is an online understanding language difficulties guide with activities and resources and activities parents can do. I think that's kind of empowering for them to be fed some of that material. So I think technology can play a really positive role. I totally take on board Rosemary's comments about not too much technology for the children or appropriate levels. But that's some of the things I can think of.
Can I just ask a question, because I'm not doing any research anymore, but do we need some research, and Simone, this might be something you're interested in, do we need some research around how effective some of these apps are across all groups in society? Like I know there's some apps that are used for Aboriginal kids for mental health. How good are they? Maybe it's time to have a look at the effectiveness and the accessibility and effectiveness, of some of these apps, and really have a look at that, because it's very attractive. We'll do an app, but we've got one that's being developed by a group that I'm working with at Murdoch University, Yank Girards, headed up by Rhonda Marriott, and it's an app for young mothers called Baby Coming You Ready, and it seems to be going very, very well. So there's a whole lot of positive stuff, but we need to know. And do we need to ensure that the people who are going to be targeted by these apps have a real role in developing them and making them appropriate for their particular group or subgroup or whatever? Because there's just such diversity of, as I said earlier, capacity and abilities and so on for parents in these things, and the children as well. But I think that'd be a very interesting project to have a look at.
Definitely that idea of co-design between families, parents, children and app developers to bridge that gap, because I think, and correct me if I'm wrong, Dr. Cahill, that type of research is happening into the efficacy of these apps, but the way that it translates into real world settings just isn't well understood and is quite varied. Would that be your experience as well, Dr. Cahill?
Yes, well, certainly, and I completely agree with Fiona's point about the need to systematically evaluate not only the quality of the information, but its reach, you know, and who is engaging and to what extent, and is it supportive? You know, there are lots of research questions. So that's a vital thing. I think one of the challenges that we have with technology, and it's not unique to the early childhood field, is that there's just such a lot. And there's you know, people tend to shop, you know, like we use Dr. Google, and if the response that you see resonates with your own hunch, then you say, well, that's definitely what I've got, or that's definitely the answer. Whereas you know, so you can shop around. It's a bit like, you know, lies, damn lies, and statistics. You can always find an answer that reflects your hunch, and it's about applying rigor, you know, applying rigor and credibility to the research that you're undertaking, so that you know, we can have confidence in the answers, but more importantly, that we can translate them and make them available and accessible to families.
Well, I guess the last point about that, which we've been thinking of in relation to things like fetal alcohol syndrome and these mental health apps, is that because you can use them anonymously, you don't have the stigma associated with it. And I think that's another thing that's probably positive about using an app. Yeah, just the point.
Great. I'm deciding whether or not we've got a couple of minutes for an additional question or whether we should start wrapping up. Did any of our presenters on our panel want to have any final remarks regarding today's conversation about how we are translating health initiatives into children's learning environments and connecting both from a systemic level as well as with the individuals?
Well, I'd just like to go back to this idea about encouraging more stories about this in the media and so on. And I think, you know, obviously we'd have to think about how that works. But the people who are really good at telling these stories, there's a huge amount of fabulous, and of course I'm biased towards the First Nations, but in terms of some of the stories and films and short films and so on that are being made now, I mean, The Little Boy With My Blood It Runs was a film that's gone all over the world, and he's actually now spoken to United Nations. I've just forgotten his name, but I don't know how many of you have seen In My Blood It Runs, but it's one of the most beautiful stories about how a Northern Territory little either a Ranta or a Yolngu boy couldn't be educated because the system didn't suit him. And I can't believe some of the interviews with the teachers in the school, really the kind of education that they were giving these kids, or whether it was faked. But it was a very important film, and I don't know how many people saw it and how much they were influenced by that. But it seems to me that a picture can speak 1,000 words. We have to get this on the agenda. As Claire and Rosemary have said, this is a disaster if we don't get it on the agenda. And we keep on saying, you know, there are these rising rates of problems in kids. They're very expensive to treat when it's too little too late at the end of a pathway. And if you look at closing the gap expenditure, it's horrendous. The expenditure on closing the gap is always at the end. It's at the end when the kids are suiciding and the people are on renal dialysis and the people are having heart attacks, when it's so obvious that the investment has to be early. So it really has to be, I think, and I'll keep on advocating for this till I cark it, which might not be too long away, but still, you know, because it is such an important issue for Australia.
Can I just add to those wonderful comments that, you know, there is a really powerful economic argument here that you're alluding to. And it's interesting, at Spell Victoria, I've got access to research which was done in the UK on youth detention prison populations, which show that, you know, around 2,000 young people in one prison, 56% to 62% are dyslexic.
Yeah, yeah, yeah.
Well, I don't know what I don't know what the equivalent data is here in Australia or Victoria. Well, I don't think we've asked.
Yes, we have, and I think the Banksia study done by Telethon Kids shows that up 85 to 90% of kids in detention in Banksia have an intellectual disability or a developmental disorder. And what do? We bloody lock them up. And what's kind of remediation and wonderful health and educational services being provided there? Probably not fantastic. So once you end up in that detention centre, forget it. But that's extraordinary.
So I guess what I'm saying, Fiona, is that I'm looking from our perspective at the prevalence of dyslexia in those.
Yes.
I don't know what the prevalence rate in Australia and Victorian prisons is of dyslexia.
No.
I've got the research in England, and I kind of go, we haven't asked the question, but I kind of don't need to, in the sense that when you know the problem's that big,
yes,
we can short circuit that problem if we get it right at the start. And that's what we need to do. And maybe the argument that needs to be made, and I'm taking your point about the media, is that we need to make the economic argument to the politicians, if nothing else, because it just does not add up to not get it right at the start.
Well, I've just received a letter. I'm on a justice reform initiative with a group of people around the nation, and I've just received a letter. I hope I don't cry when I tell you about this, because it's so unbelievably tragic. And he has been in a prison for quite a long time, and he's not going to get on parole. And he just is explaining the incredible difficulties he's having in accessing education. It's one of the most beautiful letters, beautifully written, well argued. If I'm interested in justice reform, he said, am I going to take it on board about what we need to do to turn people around? Now, this young man, I don't know what he's done. I think he's Aboriginal, but the chances to remediate him are very, very high if we could invest in that in the prison population. And we know that's for women in prison as well. So I think you're probably right, Claire, that there's a high proportion of these problems, but they're not without the ability to turn people around. He certainly doesn't have dysgraphia, let me tell you.
Thank you very much to our panel, and thank you to everyone for all the comments coming into the chat. I hate to interrupt this conversation as it is incredibly insightful and could, I think, go on for quite a long time. It's been a privilege to be the chair of the first of many events between the Thrive by 5 team and Tali Health. Our collaboration is born of mutual dedication to children's positive growth, development and general wellbeing. At Tali Health, our focus is to deliver the safest and most effective digital solutions to address one of the most common neurological issues experienced by children, attention difficulties. As much as we'd like to help with all of the issues that we've brought up with today, attention issues can significantly impact a child's ability to understand their environment, learn and socialise. At Tali, we design, develop, research and deliver evidence-based and fun tools, importantly, to assess and improve executive, selective and sustained attention in children aged 3 to 8 years. If any parents, research collaborators, educators or healthcare professionals would like further information about Tali and our engaging tools like Tali Detect or Tali Train, please head to the link that is being posted hopefully in our chat box, and myself and our team are ready to assist and help with any inquiries. Both the Minderoo Foundation through the Thrive by 5 initiative and Tali Health are committed to the innovation and reform of Australia's health and learning systems to ensure all Australian children can access high quality early learning experiences and professional supports. A reminder that this event has been recorded and will be accessible in the coming days. And for those who have registered to receive an attendance certificate toward professional CPD recognition, there will be a link and a brief learning survey sent out shortly. Thank you again sincerely to our generous speakers for your time and your invaluable insights. To close our event, I'll throw back to you, Jay.
Thank you, Dr. Simone, and thank you for all the panelists as well. And just to really build on something that Fiona Stanley mentioned about stories. Stories are incredibly powerful. They're the content that drives essentially our ability to speak to the broader community. In a media-saturated society, it's critically important that you cut through with a message. And lest there be just a cacophony of noise, we have to actually make sure that our messages hit the mark. That means while we have many supporters, we need to really speak with one voice. And that's really the point of the Thrive by 5 campaign, is to try and essentially gain leverage on the political process. I mean, we've always had impeccable arguments. The arguments that Fiona's been making for 30 odd years, many of you have also been making to decision makers and policy makers over an extended period of time are impeccable. They're based on science. They're unarguable. But you need something more than just good arguments in politics. You need to actually create pressure for change, where, frankly, you can extract a political penalty for people that don't agree with us. And that's what we're seeking to do. We actually have to, of course, the arguments are important, and every now and then you'll get a leader that will be persuaded just by the arguments. But we also need to mobilise something more, that is the force of numbers, frankly, in seats that count, that can actually make a difference at election time. So the more of you that can actually join the campaign, so thriveby5.org.au, so join the supporters list and encourage others to join it, because we will then craft a supporter journey for everybody that's signed up that can then send a message to individual MPs. We're heading to Canberra in the next fortnight for a couple of weeks of really very intensive effort. The signature piece will be a National Press Club event, but there are a whole range of other events in and around that. A symposium that will be chaired by the Parliamentary Friends of the Early Years, and we'll have a series of meetings with a number of members of Parliament. But when we go there, we want to go with stories, which are powerful stories that can influence individual politicians to act. So I very much encourage you to get involved. If you register for the campaign, you will then get updates about how the campaign is going, and we really would like to thank all of you for not only the work you do on a daily basis for children, but also if you can carve out a little piece of your discretionary time to actually invest in this campaign. I mean, campaigns come and go, and you might be asking yourself, why this one, why now? I think there is, the post-COVID environment does present threats as well as opportunities. It has put the early years on the agenda because it's a service system that did not fare well during the COVID. And I think in a post-COVID environment, people are asking themselves, what's important in life? What does the future look like? How are we going to actually rebuild our economies and our society after this rather dramatic event? So I think big, bold issues like this, ironically, paradoxically, are actually more likely to achieve than they are in perhaps more ordinary times. So I think we do have an opportunity, and we're really encouraging everybody to get involved and grasp it. So thank you so much for being part of this, and we hope to find many other opportunities to reach out to you. And if you could reach out to your networks, it would be wonderful. Thank you all. Bye-bye, everybody.